Hi there, and welcome to another edition of the Ask Dr. Jack Show. I am Dr. Belitz, your host and answerer of all questions asked. Today we are going to talk about vitamin C. Now, I've talked a lot about vitamin C in the past, about how good it is for you in so many different ways. I've even talked about this particular subject, in which case we're talking about is cancer. And we've known for a long time now that that vitamin C can kill cancer cells. We've just never known how, and quite frankly, for a lot of people, who cares? If it works, and that's the main thing we worry about. But then there are other people that want to know exactly how it works before they start considering it, and so you won't often find me doing this, but I'm about to give thanks and praise to the people over at University of Iowa, of all places. Yes, they've actually done some research there that is pretty decent, despite them having the football team they do. Anyway, what they did was they found out the mechanism by which vitamin C is killing the cancer cells, and by finding that mechanism, they can figure out from there which types of cancer will be more susceptible to the vitamin C therapy. So here it is. Basically, what happens is when you have vitamin C in a high enough concentration, it produces hydrogen peroxide in cells. Now, hydrogen peroxide is okay in cells. It's not going to kill them until it gets to a certain point, in which case it kills both good and bad cells. However, there is a mechanism by which the cells will actually bail out the hydrogen peroxide when it gets to be too much. And the way it does that is a chemical called catalase. And so if the hydrogen peroxide gets to be too much, this catalase comes in and basically starts dumping the hydrogen peroxide out of the cells. Now, all cells have catalase, but cancer cells have much less than normal healthy cells. And so if you start increasing the amount of hydrogen peroxide in your cells to a certain point, the good cells are going to be fine because they got enough catalase to bail them out, but the cancer cells will die because they don't have enough to bail them out. So really awesome research. Now all we have to do is start measuring the different types of cancer cells and figure out which ones are going to be more susceptible to this therapy, and we're going to have a winning combination. Now, obviously, this particular information is cutting edge. It's right here on the border, so we don't have that research done yet. But rest assured, it is going to be on the way. And how cool is it that medical doctors are actually using therapies that aren't going to kill you in general? I mean, I am so impressed with this. So that's the next step, is to figure out which cells. Now, the thing about this that you have to realize is that the amount of vitamin C levels that you need are not going to be reached by taking it by mouth. In other words, you can't take vitamin C orally and expect to have the same results killing cancer cells. And the reason is, quite frankly, that the intestines can't absorb enough vitamin C quickly enough to maintain those high levels of vitamin C that are needed to produce the hydrogen peroxide. And so in order for this to actually work, you have to take intravenous vitamin C. But I would much rather have a person consider intravenous vitamin C therapy versus chemotherapy or other types of things like that. So anyway, I was really impressed, intrigued, and amazed at this study and what it represents for the future. I'm very excited about it. I hope you are too. So if you know of anybody struggling with cancer, by God, who cares if we have research into that particular, see how much catalase there is in that particular cell? Vitamin C is not going to kill you. So maybe suggest that they start doing some intravenous vitamin C and boost those level up, and who knows, maybe they might find a solution to that. Okay, that's it for this episode of the Ask Dr. Jack Show. I am, of course, Dr. Jack Belitz, your host and chiropractor in Omaha, Nebraska. If you have any questions that you would like me to research and look up for you, email me at askdrjackb, that's B-E-E, at gmail.com. Call the office at 402-333-4848, or walk into the office and give me your question in person. If you know of anybody that is dealing with cancer, let me tell you, chiropractic can help in so many ways. It will keep your body's nervous system functioning at full pace. So even if they do have to go to the more terrible drugs that we'd rather see them not taking, those drugs will be used more efficiently. And what can be said for that? I mean, that's amazing. So get them into a chiropractor. I would love to help you out. We've got a computer that can measure whether or not we're going to be able to be of service to you. So again, the office number, 402-333-4848. Look forward to seeing you on the next episode of the Ask Dr. Jack Show. You have a very happy and healthy day.